Gentlemen, I need you to stop scrolling for just 1 second. What I am about to tell you in this video is something most men do not find out until it is already entirely too late. I do not say this to use fear as a tactic. I say this because I have spent over 2 decades as a urologist, and I have sat across from thousands of men. I have treated young men in their 20s who thought they were invincible, middle-aged men in their 40s who were too consumed by their careers to pay attention to their bodies, and men in their 60s and 70s who finally walked through my clinic doors wishing they had done so 10 years earlier. Do you know what the most common phrase I hear in my consultation room is? Every single time, without fail, a patient looks me in the eye and says, "Doctor, I wish someone had told me this sooner." That statement breaks my heart every single time. It breaks my heart because I know that the vast majority of the conditions I treat surgically could have been prevented, medically managed, or even completely reversed if only these men had possessed the right information early enough. Today, I am going to be that someone for you. I am going to tell you the vital medical truths your primary care doctor might not have the time to explain during a 15-minute physical. I am going to share the things nobody talks about at the dinner table or over drinks with friends. These are the actionable, scientific truths that, if you actually apply them, can genuinely change the trajectory of your health, your energy, your romantic relationships, and your lifespan. This is not a scare video. This is a medical wake-up call from a board-certified female urologist who has seen enough completely avoidable suffering to know better. I have watched men suffer in agonizing silence. I have watched beautiful marriages strain and break under the heavy weight of unspoken physical problems. And I have watched men completely transform their lives and reclaim their vitality simply because they finally received the correct biological information. So stay with me. This matters more than you realize right now. Welcome back to the channel. I am Dr. Judy Geller, a board-certified urologist and men's health specialist. I have dedicated the better part of my medical career to helping men understand exactly what is going on inside their own bodies. Because let us be brutally honest, men are not historically the best at asking for medical help. And I genuinely get it. There is a pervasive culture surrounding masculinity that dictates you push through the pain, you do not complain, and you handle your problems on your own. But I need you to understand a fundamental medical truth. Your physical body does not care about that culture. Your prostate does not care about how tough you are. Your kidneys do not care about your stoicism. Your hormones definitely do not care about societal expectations. They are biological systems, not political statements. When a system breaks down, it requires intervention, not silence. What I am going to share with you today are the most critical, most routinely overlooked, and most impactful medical realities I wish every single man knew, starting in his 30s, managing in his 40s, and mastering absolutely by his 50s. Whether you are watching this for your own health or for someone you love, I need you to share it. This isn't just information. This is biological ammunition. This is the exact knowledge that makes the difference between a life of thriving vitality and a life of quiet, painful decline. Let us start with the organ that brings the majority of men into my office, the prostate. I want to be incredibly clear about the anatomy we are dealing with here. The prostate is a small, walnut-sized gland that sits directly below your bladder and completely surrounds your urethra, the tube that carries urine out of your body. For about the first 30 years of a man's life, that little gland just quietly does its job contributing to seminal fluid. No drama, no fuss. But then, somewhere around the age of 40, and almost universally by the time a man reaches 50, that little walnut begins to grow. This growth is clinically referred to as benign prostatic hyperplasia, or BPH. The word benign simply means it is not cancer, but let me assure you, it is absolutely not harmless to your quality of life. When the prostate enlarges, it physically squeezes the urethra. I want you to imagine stepping firmly on a running garden hose. The water still comes out, but the stream is incredibly weak, it is agonizingly slow, and it takes forever to empty the hose. Does that sound familiar? Here are the blaring red flags I need you to pay immediate attention to. You wake up 2, 3, or 4 times a night just to urinate. Your stream is noticeably weak, or it constantly starts and stops. You leave the bathroom feeling like your bladder never fully emptied. You experience a sudden, violent urge to go, and sometimes you barely make it to the toilet in time. You experience embarrassing dribbling after you thought you were completely finished. Men sit in my office and say, "Oh, Dr. Geller, I just assumed that was normal aging." And this is exactly where I put my medical foot down. Common is absolutely not the same thing as normal. Just because a symptom happens to a large percentage of aging men does not mean you are required to accept it as your permanent destiny. We have incredible, highly effective treatments available. We have targeted lifestyle changes, excellent daily medications, and incredibly precise, minimally invasive procedures that can genuinely and completely restore your quality of life. But I can only help you if you speak up. I can only fix it if you come in. Please, I am begging you, do not wait until you are in absolute agony and can barely pass a drop of urine to walk into a urologist's office. Early intervention in urology is absolutely everything. I have seen men wait so long out of sheer stubbornness that their bladder muscle begins to suffer permanent, irreversible damage. And that damage is avoidable. Every single time it is avoidable. Now, let us transition to a topic that affects men profoundly. Yet most men either do not realize it is happening, or they feel far too embarrassed to ever bring it up with their doctor. Testosterone. Starting right around the age of 30, men begin to slowly lose about 1% of their natural testosterone production per year. 1% does not sound like a massive biological shift until you actually do the math over decades. By the time a man is 50, he could easily possess 20% less testosterone than he did at his absolute peak. By 60 or 70, that deficit becomes severely significant. And I need you to understand that this is not just about your sex drive, although yes, your libido is heavily affected. Clinically low testosterone, which we officially diagnose as hypogonadism, manifests in ways that men constantly and tragically mistake for simply getting old. Let me describe the textbook patient I see in my office every week. He is in his late 40s or early 50s. He is exhausted, not just physically tired after a long day, but emotionally and spiritually flat. He has rapidly gained stubborn weight around his belly, even though his diet hasn't changed a bit. He has lost significant muscle mass and strength, even though he used to be highly athletic. He doesn't sleep well. He is highly irritable, moody, and perhaps struggling with low-grade depression. His baseline motivation is completely gone. His core confidence has taken a massive hit, and his relationship is suffering deeply because of intimacy issues he is simply too ashamed to talk about. That man sits in my office convinced that something is profoundly wrong with his mind or his character. Half the time, the problem is entirely his hormones. Now, I am absolutely not stating that every single man over 40 requires testosterone replacement therapy. I am not a pill pusher. What I am stating is this. If you feel like a dim, fading version of your former self, you owe it to your own life to get your hormone levels clinically checked. A simple, early morning blood test, measuring your total testosterone, your free testosterone, LH, and FSH, can tell a physician so much about your internal engine. Once we possess that exact data and know what we are dealing with, we have a multitude of options. We always begin with aggressive lifestyle interventions first, optimizing your deep sleep, implementing heavy resistance training, drastically reducing alcohol consumption, managing chronic cortisol and stress, and optimizing your macronutrient nutrition. These behavioral changes move the hormonal needle significantly. And when lifestyle alone is not enough to cross the threshold, there are excellent, safe medical options we can discuss together as a team. You are not biologically designed to feel like you are fading away in your 50s. That is not the deal. Do not quietly accept that decline without forcing a physician to ask why. I have had patients come back to me 3 months after optimizing their hormones and tell me with tears in their eyes that they feel like they have been given a second chance at life. That is not marketing hyperbole. That is the raw, undeniable power of getting your endocrine system right. I need to spend a crucial moment discussing your kidneys, because the kidneys are the silent assassins of the human body. They are the organs that sneak up on you like a thief in the night. Your kidneys tirelessly filter about 200 liters of blood every single day. They precisely regulate your systemic blood pressure, meticulously balance your electrolytes, and produce vital hormones that tell your bones to stay dense and your bone marrow to produce oxygen-carrying red blood cells. They are extraordinary, complex organs, and the terrifying truth is that most men have absolutely no idea their kidneys are in severe trouble until they have already lost 50 to 60% of their total kidney function. That is the absolute cruelest part about chronic kidney disease. It presents with absolutely zero symptoms in the early stages. You feel perfectly fine right up until the catastrophic moment you don't. The biggest risk factors for destroying your kidneys are uncontrolled high blood pressure, type 2 diabetes, and a massive one that always shocks my patients, chronic NSAID use. If you are the guy who pops ibuprofen or naproxen like candy every single day for your lingering back pain or your post-workout soreness, I need you to hear me clearly. Over time, that daily habit violently damages the microscopic filtering units within your kidneys. Here is exactly what I need you to do. At your next physical, ask your primary care doctor for a basic metabolic panel and a simple urine test once a year. That is all it takes. We look at your creatinine levels, your estimated glomerular filtration rate, eGFR, and check for any trace of protein in your urine. These three simple numbers will tell us if your kidneys are under severe stress long before you ever feel a physical symptom. On the daily lifestyle side, you must drink actual water, not just coffee, diet sodas, and energy drinks. You must aggressively control your blood pressure. Even slightly elevated blood pressure quietly, methodically destroys kidney tissue over a matter of years. You must consume significantly less sodium. Restaurant food, processed snacks, and fast food are absolutely loaded with toxic levels of it. If you have been diagnosed with diabetes or prediabetes, you must take it incredibly seriously. It is the #1 leading cause of total kidney failure in men. Your kidneys are working incredibly hard to keep you alive every minute of every day. The absolute least you can do is not ignore them. I have had patients who only discovered they were in early-stage kidney failure because I ordered a routine preventative blood test. And I have had patients who discovered they were in total kidney failure while lying in a bed in the emergency room. Trust me, you want to be the patient who finds out in the clinic. All right, I know this is the exact topic some of you have been waiting for. And I also know some of you almost clicked away the moment you realized where this was going, because this topic makes you incredibly uncomfortable. Stay with me. This might save your life. We need to talk about erectile dysfunction. ED affects approximately 30 million men in the United States alone. Worldwide, that statistic is absolutely staggering. It is one of the most common, pervasive conditions I treat as a urologist, and yet it remains one of the most under-discussed, deeply stigmatized topics in all of medicine. Here is the fundamental medical truth I need you to understand, and please, let this sink in. Erectile dysfunction is not a character flaw. It is not a sign of moral or masculine weakness, and it is absolutely not just a localized problem about sex. Erectile dysfunction is, first and foremost, a severe vascular condition. In the exact same way a heart attack occurs because blood cannot flow properly through the clogged coronary arteries, ED happens because the vital blood flow to the penis is severely compromised or blocked entirely. And here is the terrifying medical reality that should instantly get your attention. Because the blood vessels supplying the penis are significantly smaller than the arteries supplying the heart, they become clogged much faster. Therefore, erectile dysfunction can actually act as a blaring warning siren preceding a major cardiovascular event, like a massive heart attack or a debilitating stroke, by 3 to 5 full years. Your erection is the canary in the coal mine for your heart. Gentlemen, your health is not something that happens to you. It is something you actively manage. Do not wait for the catastrophic breakdown to finally start paying attention to the maintenance. If anything I have said today resonated with you, if you recognized yourself or a loved one in these descriptions, please hit the subscribe button, share this video, and schedule that doctor's appointment you have been putting off. I am Dr. Judy Geller. Thank you for your time, your courage, and for trusting me with your health today. I will see you in the next video.